Hi, everyone. Good morning. Thank you so much for being here. This is Alexandra, MDPen Brand Educator. I am here with Emilie. She is the owner of Elevate by Emilie Eve in Novi, Michigan. And I'm so happy to have her. We're going to be talking all about the eyes today. I'm going to give my own little brief introduction of Emilie right now. She has been an amazing professional with MDPen. She's offering all types of eye treatment in her studio. She does, of course, offer microneedling, and they do a lot of hair restoration. But for the purpose of this video, I wanted to definitely focus on her eye treatments. She is an RN of 6 years. She has over 2 decades of experience in the nursing industry, and she can offer everything from neuromodulators to permanent makeup to microneedling and much more. So people are coming in focusing on the brows, the eye area, and of course there's so many things that people have concerns about when it comes to the eyes. So I was very happy to have her as my guest today. Emilie, is there anything you want to share about your business or how you got started or how you decided what exactly you wanted to offer?
Thanks for that great introduction. So you really kind of touched on a lot of my history and where things came about, but I'm actually, my home as far as nursing is pediatric intensive care. And so I was there for the past 6 years and I absolutely love my job. But as we all know, things got really tough in healthcare in the past few years. And so I was kind of looking at what I could do differently, but still help people in a different way. And that's how I got started on this mission of just building my own business in different services that I would offer, such as the microneedling. We started out actually with something as simple as lash extensions. Went from lash extensions up into the permanent makeup, and then went on to the microneedling, and now I'm an aesthetic nurse injector.
That's fabulous. And Emilie also offers things outside, of course, microneedling. And just like any nurse, like she's wonderful because she knows the timing. If someone wants both neuromodulators and microneedling and maybe even microblading too, of course, when it comes to the eyes, there's concerns such as hollowing, fine lines, wrinkles, texture, crow's feet, um, fat pads, all types of things, ptosis, eyelid laxity. So she has all these things, up her sleeve as far as treatment. Again, guys, feel free to ask questions in the comments. The first thing I want to ask the audience as a group, this is going to be a giveaway. I want to know why I would bring up MDPen's hydrating cleanser on this live all about the eyes. Why would I bring up a cleanser on a video that is all about the eyes? What does this cleanser have to do with the eyes? It's MDPen's hydrating cleanser. You can type it there in the comment and I will kind of, be watching for this. So do please let me know if you know the answer to this. Now, let's see. Emilie, what would you say is like your main audience that you see in your practice as far as age groups? Is it kind of like all across the board?
Because I offer so many different services, I have a very, very diverse population. So I don't have one type of population over another that is, I guess, the dominant. But what I can say is I've actually had quite a few male clients reach out for neuromodulators, talking about specific areas, the crow's feet and the glabellar region, which I really was surprised about. As I'm fairly new into the aesthetic injections within the last year and a half. So when I had more men reaching out, I was like, oh my goodness, this is pretty amazing that men have the right to feel just as wonderful and beautiful about themselves as women do. And I think that's something that we need to get more across the board. Like, it's okay, and we can treat that for you guys too. So that was my biggest service right now that people are asking for is my PRP hair restoration, which I know we're focusing on eyes, but that's one of my biggest services, as well as the crow's feet and glabellar region for the neuromodulator.
Yeah, I think crow's feet are definitely huge. And with eyes, I would say even by the mid 20s, a lot of people can start to see the eyes, as the first area showing changes or aging or hyperpigmentation. And I love that you guys have designed your studio and your menu of services in a way that men feel comfortable, and you bring in that male audience. I think that's really important. And a lot of med spas that want to attract men can often, miss that element. We do have people, really young now, wanting to do these services, and clients that are lash or microblading patients may very well, cross over into these other treatments.
Yeah, that's exactly right. That's how, like I said, I started with the lash extensions, and my business has just been building and building and building. And it's word of mouth. People learn to trust you. They know that you're taking them serious and that you care about their well-being, and then they'll tell everybody who's close to them. So that's important, that you're really making sure their best interest is at hand.
Awesome. So someone's asking, what is the most common eye concern you hear? Emilie did answer that. It's frowning at the glabella, which she sees often with male clients as well, and crow's feet. I noticed too, like one thing with men, and I know we talked about this, men hate looking tired. It's not always just like an aesthetic or beauty concern. Men don't like to be asked, why do you look tired, or you look like you haven't slept. So no one wants their eyes to give off that tired vibe, especially if they're not tired. So I'm still scanning the comments for that giveaway, guys. Kathleen, can you elaborate on that? I think you're talking about the hydrating cleanser preconditioning. If you can just elaborate a little bit, I think you're on the right track with the cleanser there. We have someone asking what type of marketing has worked best for your business. I know you're much busier than you ever expected to be.
Yes. I started off initially all my marketing on my own, which, let me tell you guys, is brutal. I was working between 60 to 80 hours. I'm still working 60 to 80 hours a week. So I do about 10 to 12 hours a day in my clinic, and then I'm up about another 5 to 7 hours at home going over my photos. Before and after photos are a must. Videos of your procedure are a must. And so when you're doing those things, then I was spending them 6 to 7 hours at night editing those, putting them in reels, putting them in Canva, and designing flyers. But now I have this really amazing friend of mine who stepped up, and she's awesome with marketing, and she's been helping me a ton, and I appreciate her so much. So if you have somebody like that, that you could reach out to, I know it's not always often. I'm very blessed in that department. But we are working on some things to help with other businesses in the near future. So just kind of stay tuned if you want to follow. Hopefully in the near future, we'll be offering some marketing help and stuff.
That's wonderful. And I know you're in Novi, Michigan. Is Detroit the largest city?
Yeah, the largest nearest city. Yeah.
Okay. So that's the area Emilie's in, if anyone's interested. I have someone asking what your most requested or popular treatment is. I think you kind of touched on that.
So currently, right now, it doesn't have anything to do with the eyes. I do get a lot. Actually, they're kind of hand in hand. So I have most of my clientele are interested in my neuromodulator to help treat fine lines and wrinkles. And then it's also got medicinal uses, such as for migraine treatment and TMJ. But on top of that, I'm doing really, really well with platelet-rich plasma hair restoration. And those two are neck and neck as far as the most inquired about services.
Awesome. And some questions about post-care. Do you give patients an option of buying post-care treatments, or do you kind of just bundle them into the treatment itself?
I do both. So they have the option of buying the MDPen treatments, and then we also offer with bundles. So for example, I have a vampire facial bundle. Obviously we know vampire facial is the platelet-rich plasma, where we microneedle that back into the skin, treats fine lines, wrinkles, age spots, melasma, all kinds of great things with that. Also tightens and lifts. So that's hopefully that's where my marketing is leading toward, trying to push that out right now, because it is such an amazing service with great results. But with that, people can get a bundle with, if they purchase the actual service, then I'll include the hydrating cleanser, the hyaluronic acid serum, copper mist, and then sometimes I really promote the SPF, because obviously we want to take care of our investment. These aren't cheap services, and there's no point in investing in that your skin to take care of it, and then you walk out and you go right back to your same habits. So we want to make sure we're protecting that. So I really encourage people to purchase the bundles. They're a little bit more expensive, but it gives them a discount compared to buying the products individually.
Absolutely. Thank you so much for that thorough answer. And I know the post care can change, treating hair restoration, treating full face, treating the
Right.
eyes. I know Emilie mentioned Tighten and Lift, which is one of our serums designed for the eye area. It's also an amazing full face moisturizer. It does tighten and lift, guys, so you can use this on the jawline, neck, eye area. And her having a male clientele as well as female, men really do like this moisturizer. It's our lightest moisturizer from MDPen and very easy to layer and apply. Caroline in the comments is asking, Emilie, what's your best serum you use when microneedling?
Typically, the best serum I use is the hyaluronic acid in combination with the client's personal plasma, the platelet-rich plasma. Obviously, I'm really big on results. I'm really big on being transparent, and I'm really big on giving people the best results for their money. Platelet-rich plasma is more expensive, but I know it works. And so it's almost like comparing regular microneedling with radiofrequency microneedling. So if I just use hyaluronic acid serum on somebody, I might get decent results with one treatment. But if I use platelet-rich plasma in combination with the hyaluronic acid, I'm going to get huge results. So that's what I really try to promote. But obviously, it's not in everybody's wallet to do that. So I always give them the option.
Absolutely. And I do have a shopping code for you guys that are interested in purchasing any of these items. And the code is AskMe26. You can use this on our website to go shopping, AskMe26, and you could shop as retail or professional with that code. I'll go ahead and leave that on there. This is a great question as well. Are there do's and don'ts when it comes to before and after a treatment around the eyes?
That is a good
So
question.
yeah, I guess there's kind of a lot of them.
Yeah, there's a lot.
Are there any do's?
Yeah, sorry. As far as do's and don'ts,
It's okay. You can go ahead.
I have consultation for anybody who comes to Elevate. I try to reach out to them prior. We get a health history. I use a program called Aesthetic Record for anybody who's out there in this business. Check it out. It's a good way to keep everything in one place. But in Aesthetic Record, I've designed my consents and I've designed everything I need to keep their health questionnaires together. There's some things like for people with rosacea and such, you're not going to want to microneedle over that. It's a contraindication. So we have to know these things. We have to know their health history. We have to know what medications they're on. Are they on anticoagulation? Are they taking aspirin every day? Because these are things that if it's not safe for them to stop, it completely contraindication for the service. But if they can stop, then I ask the people who are taking maybe aspirin just for something not medically necessary, something else that they might be taking it for, or say coffee, caffeine. Please avoid caffeine, alcohol, aspirin if they get headaches, no Excedrin or anything for 24 to 48 hours prior to coming in, because we want to decrease inflammation, decrease the potential of bleeding and all of that. And it actually, caffeine, surprisingly enough, increases your sensitivity. So if you have somebody who's really sensitive, they're already, like, for example, my ombre brows that I do, some people have a huge pain tolerance and they're fine. And some people, they're jumping out of the chair and you're like, wait, what's going on? But then you find out they had 4 espresso drinks the day before. It's like, okay, now it makes sense. So those are some things I would say definitely avoid before. And then as far as to do, you want to make sure that you're taking care of your skin. You want to make sure you're doing the aftercare, using the products that are going to keep that investment.
Thank you so much. Those are great answers. And Emily, being an RN, she highlights the really big health
Yeah.
ones. I'll go ahead and say too, you really need to watch out for depilatory removal of any kind. You don't want them to have waxed, their eyebrows, or if they have an eyebrow wax, scheduled the week after their microneedling treatment, that's going to be a huge no-no. Same thing, like if they were recently microbladed, obviously you're not going to be able to microneedle near the area. So these are big things that come up. Even when I'm doing an LED light treatment on someone, if they look like they've had recent microblading, if they like their microblading or permanent makeup, like I let them know, do you want me to cover the area? Some people would like for their brows to fade. They don't care. But there's definitely a lot that goes into asking. Also things like prescription strength retin-A or tretinoin. A lot of people use it around their eyes as well as their entire face every night. So they want to stop that a week prior to a treatment that would be done on their eyes. I would imagine with something like permanent makeup for the brows, you would probably want them to stop it even sooner than further out than a week.
30-day rule. So if they're using glycolic acids, retinol, anything like that, I like them to schedule at least 30 days out from using it around the brow area. Another thing to touch on with this question is neuromodulators. If any of your clients have had any brand of neuromodulator, then you don't want to microneedle over that for at least 2 weeks because you do not want to cause migration of that at all.
Thank you. Yeah, that's a great point. Like it's all about timing. I would even imagine with microblading or micro shading or anything else, like you'd want to know where their everyday brows kind of sit.
Exactly.
So you probably wouldn't want to do that treatment on someone that either is way overdue for neuromodulators or just had them, and get an idea that way. Thank you so much for that question, Christy. I would love for you to win one of these giveaway products. If you can send in your information to our LinkedIn account. It looks like you're commenting from LinkedIn. I would love to gift you with a hydrating cleanser for your participation. That was an awesome question. Thank you so much. Scanning the comments here, guys. Roanne is asking, which MDPen products do you sell the most of and why? I believe I know the answer to this.
What's my answer?
I know you do a lot of hair restoration and the hair products for sure. I know with microneedling patients, you do want all of them to have our copper plus HA mist to use as post-care. And then with serums, usually the pure HA for post-care. And the pure HA is great because this is the copper mist, guys. The pure HA, ours is extremely pure. It has 5 ingredients, and it's non-fragrance, no dyes, nothing like that. Very clean HA. And this is great, like across the board. You can customize, in retail, our cellular renewal or our tighten and lift once you've met the patient or based on their particular skin needs. But the pure HA is something you can bundle in advance, knowing it's going to be great for anyone.
Yeah, so you're actually dead on with everything. As far as the most product I sell, what type of product I sell the most would be definitely, I try to get everybody to purchase the cleanser, the hyaluronic acid, as well as the SPF, because sun damage is going to do the most to our skin. So when we're treating that, we want to make sure we're protecting it. And then the hair products, with my PRP hair treatments, I do a bundle. So I do a 3-treatment bundle where they get the 3 treatments, plus they get the shampoo, the conditioner, the fortifying spray, as well as a hyaluronic acid serum.
Thank you. Yes. Yeah, our cleanser is one of my top 2 favorite products from our lines. I don't think anyone answered it earlier, but the reason I brought up the cleanser in this video is you can cleanse over your eyes with our MDPen Hydrating Cleanser. It's that gentle. So I'm not just talking about at-home care. I'm talking about if you're watching this as a professional and you're someone who does lashes or treatments in this area, the patient, with their eyes closed, and your gloved hands, you can cleanse right over that area. Men love it, women love it, oily skin, dry skin. It is hydrating, but it's also a gel. I know Emilie does love our sunscreen, like she said, and our sunscreen is very nice because it has a really great lotion consistency. And it's going to not leave any type of white, chalky, powdery residue on any type of skin. So it is a wonderful sunscreen. What we kind of described is MDPen's aftercare recovery kit. Another product you can use on the eyes that we do recommend, and this is once your patient, is moisturizing, is cleansing, is using a sunscreen, get them compliant, and then you can bring in our human derived growth factor gel product into the mix. And this is going to be amazing for full face as well as eye area. This really does help stimulate collagen, elastin. It's going to help with skin barrier. It does help improve acne scars. And this is something you can wear at night, very thin layer. We do have people that use it during the day. It'll be more of a personal preference if you do want to use it twice a day. But this is going to be the big guns when it comes to the eye area with those human-derived growth factors as well. I want to highlight Emilie's information again for you guys. Any last-minute questions all about the eyes? Here's that growth factor gel, guys. Thank you so much for tuning in for today's video. Thank you, Christy, again for that great question. Do follow Emilie on her social media. You can reach her here. She's a great resource as far as someone, that's doing things outside of nursing, because a lot of people that have interest in aesthetics, they enjoy their art, and she does permanent makeup as well. So I think there's a lot to be learned here, guys. Thank you so much, Emilie, for taking the time to do this with me. She had to drive through some snow this morning to get to the office early, and I really appreciate it. And thank you so much, guys. And I look forward to seeing everyone soon on our lives.
Thank you.
Bye. Thank you, Emilie.
Bye.